Well, all you parents out there know it can be sometimes challenging to brush your children's teeth correctly. Me getting ready to be a first-time mom, I know nothing about it, but fortunately, Dr. Craig Reckheimer is here with us today with Children's Hospital. Thanks for being with us.
Thank you. I appreciate your time.
And you brought your two children, who I have to say have been in the studio all morning long, and they have just been angels, not making any noise and sitting so politely. So tell us, I mean, what do you need to know when you come to brushing teeth?
Well, one of the things we're finding is that we're finding cavities at an earlier age with children. So at Children's Hospital, we're trying to promote good oral health to help prevent some of those problems we're finding. One of the things is starting at an early age, starting at an infant age. We have a 10-month here, that's Mr. Callan, and he already has 3 teeth. So that's an age where you need to start brushing those teeth.
So as soon as they break through the surface, you need to start
That's correct.
brushing.
In fact, we try to emphasize starting when they just have gums, you know, in there that need to have all that food and all the things like that need to be brushed off. You can see he's a wiggle worm,
He's
which
darling.
is very normal for a child this age. That's what you want to see. But we certainly need to start brushing those gums and those teeth as soon as they break through, as you mentioned.
What are some ways to do that without him resisting, I guess?
Sure. One of the easiest ways we find is just using a regular finger rubber toothbrush, which is right here. And it works real well. And you're just putting a non-fluoridated toothpaste or gel on it to help brush those teeth. And I can show that to you if you'd like.
Yeah, so you don't want to use your Crest toothpaste that you have for adults.
That's correct. You don't want to use fluoridated toothpaste until after the age of 2. Typically, it's after the age is really good about spitting that toothpaste out or spitting out that fluoride, because you don't want a child to swallow that, correct?
Okay.
So we'll demonstrate here how we clean this child's teeth.
He's ready to brush his teeth.
And typically you want to try to do this more than twice a day, maybe 3 or 4 times a day.
Really?
Pretty much after the child's finished eating. So whether that's formula or nursing or just, snacks, trying to brush that off. And it's very simple to do. And you can see he's very cooperative.
And
then what we're doing is we're just brushing off those lower teeth and getting all that food off there. And then we just kind of swipe across the top as well and get that off there. You can tell there's a nice flavor to it, so he likes that as well.
He doesn't seem to mind at all.
One of the things we recommend for young children is that they start seeing the dentist at age 1, which is a pretty big surprise to some people, because you want them to have that dental experience, to visit and know what's involved with going to the dental office, know what's involved about when the teeth are coming in, and whether you use fluoridated toothpaste or non-fluoridated toothpaste. So it's quite simple.
And where do you find one of those finger toothbrushes?
Any store. Typically, these are found in the baby section of the store. Not so often in the toothbrush section of the store, but most of the baby section.
In the baby section.
Correct.
Okay, great advice. And for your a little bit older child.
Yes, we have a 2-year-old here that is laying on the floor and cooperating with us. Can you? Very good. So, a 2-year-old, we have a 2.5-year-old. Her name is Corinna. And again, you need to make sure that you brush all that food off there. So with her, you want to brush at least 2 times a day, but not 3 times a day after she's done eating. All you need is just a regular child-sized toothbrush to brush all that food off. Can you show them how to brush your teeth, please?
I bet you love brushing your teeth, don't you?
And with her, like I mentioned, you can use the regular child's toothpaste, that has fluoride, or non-fluoridated toothpaste. Again, it just depends on how well that child is, able to spit out that extra toothpaste after they're done. So would you like to show them? So you can see it's not very cooperative here, so I'll show you. So this is very typical at home when you see a child that's kind of, against or resisting you. So all you need to do is just open up their mouth and you just go through and you brush all that food off. And the big thing you want to do is check that you are removing that food, because most times there'll be animal crackers in there. There'll be any type of snacks. And you just want to go through and brush everything off and then just take a look. Check in there, that is all the food gone? Does it look clean? When you leave that food on there, that's when you start developing those early childhood cavities. And that's why you want to be really vigilant about keeping all that food off of there.
And I guess that he likes my necklace. And I guess that diet's very important, because when you talk about seeing younger cavities, I would have to think a lot of it is attributed to, oh, he's fine, it has to be attributed to, soft drinks and sugary foods. We have a lot more processed foods, refined sugar in our diet than we probably used to.
Sure. Getting cavities is, based off of many factors. One of it is your diet and what the children are eating. But a lot of it, too, is how often they're brushing and how often they're cleaning off. So even if they're eating and drinking those type of products, if they really keep up with brushing and cleaning those off often during the day, they can really avoid those type of problems.
Okay, and real quickly, you just brought a couple of things. That's the Oragel, and what else did you bring with you?
We have the Oragel training toothpaste, which is just toothpaste without fluoride, then a regular kids toothpaste that is pretty friendly to children, and then there's a spin brush, and there's lots of different companies that make versions of spin brushes, which are also very popular with kids because of the novelty of having a toy involved with brushing their teeth. So that's also pretty successful to it.
Well, some good advice definitely will help me when I have my little one, and they sure are darling. We thank you for coming on and bringing them, and we hope you Got some good tips today. Arkansas Children's Hospital, you see the address, One Children's Way in Little Rock. Coming up next, it is our puzzle person of the day. If you think you know who it is,